Welcome to Health Planning, an executive discussion series from Abacus Insights focusing on the issues and opportunities facing payers today, given the dynamic healthcare environment they operate in. My name is Minal, Patel, and it is my honor to welcome our next guest, Dr. Steve Friedhoff. Steve is an accomplished physician executive who, for the nearly last 30 years, has been a leader in multiple managed care organizations and currently serves as the Senior Vice President for Healthcare Services at Blue Cross and Blue Shield of North Carolina. Blue Cross and Blue Shield of North Carolina has the distinguished pleasure and honor of being a forefront in the value-based care initiatives, and Steve is the executive champion of these efforts inside the company. Steve, welcome.
Thanks, Minal. It's a pleasure, and I appreciate your having me here.
In terms of Blue Cross and Blue Shield of North Carolina, you're clearly a leader in this space. And can you tell us how you got there?
I think that when this was initially launched, but this was prior to the pandemic, the focus was on driving increased value in healthcare, but certainly also promoting a vehicle for primary care independence and success. Certainly, we also have had specialty models in value-based care, but the initial focus was on primary care.
Can you cite specific examples where your members, patients of your providers, benefited clinically or from a specific outcome?
We've saved over $500 million, about $650 million since inception. Roughly 2/3 of that gets paid back to physicians who have been successful from a quality and a medical cost savings perspective. And about 1/3 of that goes to making healthcare more affordable for residents of the state of North Carolina. We've seen an 18% reduction in unplanned hospital readmissions over the last couple of years. We have seen a 15% increase in the percentage of our members who manage their blood pressure more effectively. We've seen about 10,000 more colorectal cancer screenings. We've seen increases in pediatric immunization rates.
Congratulations. Those are impressive statistics and numbers. And I know this is just the beginning. Can you talk about challenges that you faced in trying to get those outcomes delivered?
There's sort of the trust but verify, right? And I think that's where a lot of the data exchange, the information sharing, the joint operating committees really start to come into play. So the challenges were and continue to be making sure that the data we share with providers is timely, it's actionable. We're continuing to assess whether improvements we are trying to make are actually having an impact. And that runs the gamut from utilization trends, emerging cost drivers, gaps in care. And as we've seen more and more providers potentially taking on downside risk, obviously that becomes far more important. So the key to all of this on an ongoing basis has been continuing to build that trust through collaboration.
I appreciate your comment around trust but verify and the cornerstone of verification being having usable, accurate, timely, and accurate data. So let's talk about data for a second. When you think about the data elements that you need in order to power your contracts and make sure that that verification is trustworthy, are there specific elements that are important and that are relevant to your work?
Absolutely. When we look at the number of data sources we have, coming into the organization, it's literally scores of them. And getting them in a format that we can understand, we can curate, we can share with providers is certainly critical.
And how about the internal processing of that data? How do you and your organization make sure that the data is linked and cleansed and matched and all the things that have to happen in order just to have that threshold level of usability?
Most of our challenge has been not so much curating that data, but just getting access to it in the first place, deduplicating it, again, making sure it's attributed to the right member, the right provider at the right time. And while we have access to some of these other sources of data, again, the challenge becomes timeliness, because as we push this information to the portal our providers utilize, again, to see their utilization trends, their gaps in care, et cetera, even if we're pushing that data out, if it's 3 months late, the provider recognizes that care gap has been closed. We may recognize it a month later, but there's that brief period where the provider is concerned we don't have the information that we need to show that they've been successful.
Steve, as a single state blue, what are the specific challenges or opportunities that you have that are unique to your market?
And I think part of that challenge is access to good data. And the reason for that is that our size and our scale certainly impacts our ability to invest as much capital in things like clinical data exchange, as a large national payer would be able to do. And lack of good data can affect our risk adjustment scores, our stars ratings, and our ability to have a credible value-based program in the end.
Steve, so for payers that are getting involved in value-based care, what should they be doing right now in order to try to achieve the success that you have?
Value-based care only works on a foundation of trust, on a foundation of transparency, and on a foundation of collaboration. So I would say focus on nurturing long-term sustainable relationships, recognize that this is something that needs to be built for the long haul, and it needs to deliver meaningful outcomes for not just the payer, but for the provider and the member.
And put the infrastructure in to verify that trust.
Absolutely.
Steve, really thank you for your incredible insights. From the work that we do in the industry, we know how hard it is for payers to get data to be usable, the access issues, all the technological challenges, and ultimately the trust issues that you mentioned are real. And you've given them some sound advice to our listeners about what they should be thinking about and how they should be approaching this. For our listeners, thank you for joining us today, and hopefully you'll join us for future episodes where we get to talk about critical issues and opportunities facing payers. My name is Minal Patel.